In today's class, we will study the cross-sectional study and longitudinal study. This topic is present in BMS third phase NCISM new syllabus research methodology chapter. In that, this topic is in the fifth chapter and third topic. Here, what is meant by cross-sectional? Cross-sectional means in a short period of times, the different patients, if you are observing, uh, collecting the information, that is called the cross-sectional study. Longitudinal study, nothing but for long period of time, 1 year or more than 10 years, 20 years, same patients if you are observing for long period of time, that is called longitudinal study. In the introduction, cross-sectional and longitudinal study studies the two major types of observational research. It means that the researcher or a scientist only observe. In this research design, the only observe the whatever thing is happening, not at all intervention in the researcher. The interventional research design commonly used in the health, clinical and social science to study populations over time or at a point of time. This is the introduction. Next is the cross-sectional study. One by one we will study cross-sectional study. First we will study the definition of the cross-sectional study. A study that observes a defined population at a single point of time or during short period of time. It means that in a short period of time you are collecting or gathering the information. Suppose in a village, if you are gathering the information, you are doing the survey, consider that how many in that village the peoples are suffering from the diabetes. That is the in one day or in a particular 1 week, in the particular short period of time, how you are gather the information, that is called cross-sectional study. The study which only observe the population single point of time during short period of time. This is the cross-sectional study. Now what is the purpose? The both purposes are different based on our research problem. First, the cross-sectional study, what is the purpose of this study? To determine the prevalence of outcome of condition. For this cross-sectional study, to determine the what is the prevalence for outcome condition. At that present condition, what is the prevalence? What is the common diseases are there at particular short period of time, that we are gathering the information. This is the main intention. Example, 40 to 60 year. Suppose in a one village, if you are gathering the information, you are checking the BP, blood pressure among the 40 to 60 years patients. A study assess the prevalence of hypertension adult age to 40 to 60 years. Simply means that in a short period of time, in one day or in particular 2-3 days, you are collecting the whole village BP 40 to 80 years. Just you are collecting, only you are observing and note down in your records. That much only you are doing here in the cross-sectional. Now what is the advantage of this research? Because this is a very quick, within a 1 day or few days you will complete, and non-expensive, it is inexpensive, not so much money required. It is useful for public health plannings. Whenever this data the researcher will collect, this data is utilized by government or other the planning things purpose for policy making peoples, they are using. The next one disadvantage of this cross-sectional study, it cannot establish causality. It means that by this collection of the data or cross-sectional study, we cannot that this is the cause and this is the effect. Just we are observing and writing it, that much only. So you cannot tell that because of this study, we cannot tell this is the cause of the disease. Cannot establish causality. And temporal relation between cause and effect. It means that it is not clear because of this cause this is happened. You cannot tell, just you observe the whatever thing in a snapshot. It means that single you taken the picture of group of peoples, that is only the snapshot you are collecting. This is the temporary things it is there. And next one, it is like a long video you are making, that is longitudinal study for long period of time. What is meant by longitudinal study or longitudinal study? The name itself, it is told that long period of time you are observing the peoples. Here the difference in both are there. The different individuals or different patients, if you are taking in the cross-sectional study, and in the longitudinal study, the different same subjects or same patient, regularly after every years or after few days, you are regularly checking or examining the evaluating the patients. That is the main difference. Now we will study the longitudinal study. Longitudinal study that observe the same subject over a long period of time to examine change and development. Okay, just now I told this is one of the study in that we are observing the same patient or same subject for long period of time to know the what are the changes and development in that individual. Next is the purpose. What is the purpose of this longitudinal study? To determine the incidence, natural history, and risk factor. Why we are gathering this type of information? To know the incidence, what are the incidents happen, and natural history, to collect the naturally what are the things are, because the research is not at all doing intervention, just is observing natural history for collecting what are the risk factors are there, why the changes are changing in that individual, for collecting that one only the risk factors. This is the main purpose for the gathering this type of the longitudinal study. Example, you can take the a 10 years follow-up of study of diabetes progression among the pre-diabetic individual. Suppose that is in your city or town or village, the few patients you are, among the 10-20 patients you observe the pre-diabetic patients. Suppose their HbA1c around 5.5 or 6 it is there. For regularly every years, every after 1 year, you are calling to collect, give the HbA1c samples. After 1 year, after every one years, if you are checking, you will get the idea the how the diabetes progress it is there in the pre-diabetic individual. For long period of time, you are observing. This is the one of the very good example. Next is the advantage. What is the benefit of this longitudinal study? Can identify the cause and relationship. In that, we can know the cause. Another one example I will give, the for the cause and relationship. That is, suppose in your surrounding area few people are smoking. Suppose 10 people smoking. In that, the lung diseases are developed. You will know after few years or after decades, you will came to know that those are smoking, in that the lung disease or lung cancer is developed. Like that, by this type of study you will get the idea the cause. This may be the cause, this may be the uh, diseases are developed. Like that, can identify the cause and relationship. Next one is the advantage is measure the change over period of time. By this type of study, the how the changes in the subject is, you can see that you can collect here, measuring the changes over long period of time. Now what is the disadvantage of this type of study? It will take long time consuming and expensive, lots of the money requires, and risk of loss of follow up, because the patient, they will change their place, or some will they're not at all interested for more than 10 years 20 years to follow up. Like that, the patients are sometimes not follow whatever you told, the risk of loss of the follow up it is there. Next is the comparative study, the comparison between the both cross sectional and longitudinal study. The features are the cross sectional study and longitudinal study. The first is time frame. The cross sectional study, only one time you are collecting, just your group of people, only one snapshot you are taking. Long term follow up, it means that long video you are making. Like that, it is one time, it is longitudinal. Long term, more than few years, decades, like that, long term follow up your subject, different individual information you are gathering. And longitudinal, in that the same individual information after few days or after few years you are gathering. Causality, you cannot tell that this is the cause, this is the effect, karya karana, you cannot tell that. And in that longitudinal study, you can tell that because of these things, this is the result. Like that, cause and can establish. Next is the cost and duration. Here, cross-sectional study, the cost is very low cost and short duration, and longitudinal study, high cost and long duration. Example, BP screening survey in the cross-sectional study. In particular area, you are checking the BP among 40 to 60 years, like that. This is survey only. And longitudinal study, the cohort on heart disease. In that cohort is nothing but the long-term study, longitudinal study. In that, the how the heart disease developed, that you are observing for a long period of time. This is one of the example in the longitudinal study. Okay, now lastly, the conclusion. The conclusion is that both the design of this research designs are important. The cross-sectional study are ideal for snapshot prevalence. It means that the cross-sectional is necessary for prevalence, or that is for single time the what is the common it is there, for that common diseases are there for prevalence. Cross-sectional is good, but the longitudinal study is crucial for understanding the disease progress, how the disease progress, and what is the cause and effect of this disease. For the collection of this one, this type of information longitudinal study we are doing. Okay, both are about the cross-sectional study and longitudinal study. Okay, hope you understood the today's class. If you understood, please subscribe the channel, like and share to your friends. Thank you.